Once upon a time, there was a man named John who was in his early 40s. John was a software engineer who studied at Harvard, indeed a very hardworking man and had a busy life. He was a project manager in a big tech firm. He was a hardworking man mentally, but only part of his body that worked hard were his fingers. His only job was to work on his computer in his office. So, he had a sedentary lifestyle. During breaks he used to order burgers, pizza and Coca-Cola from a fast food restaurant near his office building. He was a divorced man living alone in his six-figure apartment. Being home late in the evening, cooking and eating were the last thing he could do because of his hectic job. He also ate a diet rich in processed foods, high in sugar and saturated fats. Due to this bad eating habits, John had ballooned from a 170-pound to whopping 240 pounds in 1 year. Over a few months, John began to notice some subtle changes in his body. He was always thirsty, had to urinate frequently, felt tired all the time, and had a tingling sensation in his feet. However, he ignored these symptoms, thinking that they were normal changes that come with aging. He attributed the tingling sensation of his feet to him sitting on his chair for a long time. One day, John fell ill and went to the hospital. The doctor ordered a series of tests and discovered that John's blood sugar level was very high. The normal blood sugar level after eating food should not exceed 140 milligrams per deciliter. But his glucose level was 170 milligrams per deciliter after challenging his body with glucose tolerance test. It is not diabetes yet because to diagnose diabetes, your blood sugar level should exceed 200 milligrams per deciliter after eating glucose. The doctor diagnosed John with prediabetes, which meant that he was at high risk of developing type 2 diabetes. The doctor advised John to make some lifestyle changes to prevent the progression of prediabetes to diabetes, such as eating a healthy diet, exercising regularly, reducing his weight and avoiding sitting continuously for long hours. However, John didn't take the advice as seriously because of his mentally demanding job, and his symptoms continued to worsen. But they were not severe enough for this guy to take seriously as his hamburgers and projects. 5 years later, John returned to the hospital, complaining of severe abdominal pain, nausea, and vomiting. The doctors ran some tests and discovered that John's blood sugar level was dangerously high, and his kidney function was severely compromised. One of the important functions of kidneys is to remove toxic waste products from the body, which includes urea, uric acid, potassium, creatinine and various drugs. Due to kidney damage, those toxic products had accumulated in his blood to dangerously high levels. The doctors diagnosed him with diabetes and diabetic nephropathy, a complication of diabetes that damages the kidneys. John was admitted to the hospital and treated with insulin therapy and medications to manage his blood sugar and blood pressure. However, his kidney function continued to deteriorate, and he had to undergo dialysis to remove waste and excess fluid from his body. Despite his treatment, John's condition continued to worsen, and he suffered from a range of complications. Most notably, he had an MRSA lung infection during hospital stay due to his weakened immune status. MRSA stands for methicillin-resistant Staphylococcus aureus, a superbacteria resistant to beta-lactam antibiotics which includes penicillin and cephalosporins. He had be administered intravenous vancomycin to treat this infection. Vancomycin is also a nephrotoxic drug, which causes oxidative effects on the proximal renal tubule resulting in renal tubular ischemia and causes tubular necrosis. This further worsened his kidney status and he had to get prolonged dialysis and his kidneys almost completely shut down. He had to stay in hospital for a prolonged period before his kidneys recovered from vancomycin toxicity. But the damage caused by diabetes were irreversible, and he would never get his kidneys to work normally from then. In this case, John's kidneys got damaged pretty quickly than normal population. Normally, an uncontrolled diabetes takes around 10 to 20 years to develop kidney impairment. On top of that, various other factors like drugs accelerate kidney damage in diabetes. John's story is a tragic reminder of the importance of managing prediabetes and diabetes effectively before it is too late. With proper management, complications like diabetic nephropathy can be prevented, and patients can lead a healthy and fulfilling life. Diabetes is the leading cause of kidney impairment around the world, so do not take diabetes lightly even if it is not doing anything problematic at the moment. It is a slowly progressive disease that damages your blood vessels leading to impairment of your organs like heart, kidney, brain, eyes, legs, and gut. There is no organ spared by diabetes. So, please take care of your health and get regular medical checkups. Subscribe to my channel for more content. Please support me by hitting that notification bell.